My name is Dr. Alan Feldman. I'm a board-certified endocrinologist with the South Florida Endocrine Center. And today I was going to talk a little bit about thyroid disease. The first thing is, well, what is the thyroid? Thyroid is a little gland located at the base of the neck. Here's a little model that shows us what it looks like. We have the windpipe in the middle. This is the voice box, and the thyroid gland is a little butterfly-shaped gland that's located under the larynx that has part on the right side, part on the left side, and part in the middle. And it's a gland that controls our metabolism. There are three major abnormalities that can occur related to thyroid. One is having an overactive thyroid that we call hyperthyroidism. Another is an underactive thyroid that we refer to as hypothyroidism. And then one can get nodules of the thyroid that we would refer to as nodular thyroid disease. So what's the most common cause for an overactive thyroid or hyperthyroidism? It's called Graves' disease. So Graves' disease is an autoimmune disorder where the immune system is producing an antibody that stimulates the thyroid. As a result of that, the thyroid levels become elevated and people develop symptoms. The most common symptoms that we see are weight loss, fast heart beating, feeling hot, sweating easily, increased number of bowel movements, muscle weakness. In essence, the entire body is revved up. And so you have symptoms related to this condition. On the other hand, hypothyroidism is kind of the opposite. So in that condition, the most common cause is called Hashimoto's thyroiditis. And that also is an autoimmune disorder in which the immune system is destroying the function of the thyroid. So the thyroid level becomes low, and so people develop symptoms that are the opposite of an overactive thyroid. They start to gain weight. They feel tired, sleeping more, cold, hair loss. Of course, all those symptoms are relatively common symptoms in general, so most people who have symptoms of weight gain don't really have a thyroid problem that's causing that, but certainly is something to think about as a possible cause. The third type of thyroid disease is nodular thyroid disease, where one can have one or more nodules of the thyroid. The first thing to know about nodular disease is it's common, much more common in women than it is in men, more common as we get older. And unfortunately, most nodules of the thyroid are benign. These things are typically picked up on a routine examination by a primary care doctor, or picked up because another test was done, like a carotid ultrasound or a CAT scan of the neck, where they incidentally see nodules of the thyroid.